Going to try and tackle a sore subject. If your health insurance denies a test, a treatment, a medication that the doctor says you need, don't rush to pay out of pocket. Consumer Reports says that you have a guaranteed right to appeal the decision, and the good news is it's easier than you might think.
In 2023, nearly 1 in 5 in-network health insurance claims from plans sold on healthcare.gov were denied. And it was even worse for out-of-network claims. Even more than a third turned down. But a denial doesn't mean you should immediately pay out of pocket or worse, skip the health care that you need. Consumer Reports says it's easier to appeal a denial than you might think. First, call your insurance company. Sometimes a simple billing mistake or paperwork error is all that's standing in your way.
Mistakes can and do happen at multiple points in the claim filing pre-authorization process. They can be relatively easy to fix once you identify them.
If it was not a mistake, you have the right to appeal. Ask to speak directly to the reviewer who made the decision and get a clear explanation for why your claim was denied. You'll need this information for the next step, filing a formal appeal stating that you disagree with the decision.
You're going to ask your doctor to write a letter to explain why the procedure is necessary and to include any documentation to help support that, like your medical records and treatment studies, and any communication with the insurance company.
Doctors are used to this, so don't be afraid to ask. The next step might be the hardest, and that's waiting. It could take 30 days or longer for an answer. And if you need treatment right away, make sure that you request an expedited review.
So if you get a letter that the insurer is still denying the claim, know that both Medicare and private insurance companies are required by law to provide the reason in writing, as well as explain how to appeal the decision with an independent third party.
And if you get your insurance through work, consider asking your human resources department to help. If Medicare denied your claim, consider getting legal help to hear your case before a judge.
And speaking of legal help, there is a law that's supposed to protect you from surprise medical bills. However, if you still get one, Consumer Reports says that one of the best courses of action is to ask for an itemized bill and question every charge before you pay it.